Good morning, everyone. This is Carol Ewan White, and welcome to our webinar on effective grant writing for health professionals. We want to thank you for taking time out of your busy schedule to be with us today. And our presenter is Dr. Monae Raphael. She's one of our adjunct faculty and an experienced grant writer. She has a passion for public health, and today she will be sharing some of her knowledge she has gained from being a researcher in places like Johns Hopkins and at the NIH, and working with the US Department of Health and Human Services in New York. She has developed several letters of interest in response to calls for proposals, and she has managed numerous project timelines. She has created the graphics you need, work plans, supporting documents for several successful proposals. To make this webinar engaging and interactive, today you will have some polls, and the presentation is divided into sections with a Q&A session at the end of each section. And there's also a Q&A at the end of the presentation. We kindly ask that you hold your questions until you are at these times. And please remember that this webinar is being recorded. And we also have handouts for you. So without further delay, please welcome Dr. Monae Raphael. Over to you.
Thank you so much, Carol. Thank you. Thank you. And I'd like to say good morning to everyone. Welcome to our webinar today on effective grant writing for health professionals. As Carol introduced me, my name is Monae, and I will be your webinar presenter. I'd first like to just stop and thank the UNE graduate programs and public health staff. This webinar was their idea, and I'm just so very grateful for Neng, Charla, Carol, and Jennifer. Thank you for all of your help. As Carol said in the introduction, I do have many, many years of experience as a grant writer, and I'd like to share some of what I've learned to help you as you develop your grant applications. I'm sharing my contact information as we begin, just a few housekeeping items. Feel free to connect with me either by email or on LinkedIn. I welcome hearing from you. In addition, we are very interested in receiving your feedback on how more offerings, just like this webinar today, can be specifically tailored to suit your interest. So you will receive a post-webinar survey by email, and we are asking and hoping that you take the opportunity to provide us with very specific feedback. I'd just like to highlight a quick introduction as we begin. I did allude to the fact that this webinar is a first offering for UNE, and everyone is so excited to bring this webinar to the GPPH community. Now, ideally, this webinar is suited to health professionals who've written at least 2 proposals. However, if you've written less than 2 or more than 2 proposals, there will still be lots of helpful information for you to glean today. Now, in all transparency, time just will not allow us to dissect local, state, and private foundation proposals. Each of those topics could really have its own webinar. And I just want to take a moment to explain private grants in and of themselves. They are an entirely different effort. And honestly, they're best coordinated formally through an Office of Development at your organization, or through someone who's very well connected and known for their expertise in a specific area. And I would say most importantly, by direct invite or solicitation from that private funder. So instead today, what we're going to do, we're going to take a deep dive into federal government proposals. And I chose federal government proposals because they are generally very large, and I feel like they will allow us to cover a large enough landscape that will be relevant to the other proposal types. And I will try in many cases to show you that overlap as we move on in the discussion. Now, just in terms of vocabulary, I'm going to refer a lot to the funding opportunity announcement, which the acronym is FOA. This would be the same. You may be more familiar with a request for funding proposal or an RFP. That's the same as a notice of funding opportunity, also known as a NOFO, okay? So all of those are going to be the same. I'm going to say FOA for funding opportunity announcement. I just want to highlight again, as Carol said, this webinar will be interactive. We will have polls. Just to reiterate, there will be a Q&A after each section of the webinar, and then there's going to be an overall Q&A at the end. So definitely feel free to get your questions ready. We are going to put on the lens today of a reviewer, and that's how we're going to largely consider grant development and aspects of the grant application. Now, the successful grant writer is not only going to provide what the FOA requires, but is also going to be able to anticipate what a reviewer would want to know. And I'm so excited to help you develop strategies, tools, and resources to be able to do this. You will walk away with practical tips and resources so that you'll know how to make your proposal development process more effective. Let's jump right into our agenda. Here are the 3 parts that I've been discussing. First, we're going to start with a high-level view of the proposal process, and then there'll be a Q&A of that first section. Then we're going to transition into tips and implementation strategies. I've developed some nice hands-on activities that we can discuss together, and then there will be a specific Q&A for that second section. And then lastly, we're going to do that Q&A based on anything that you'd like us to address that we've discussed today. Now, unfortunately, time will not allow us to tackle every topic that I honestly think is pertinent to this discussion. So, for example, there are technical aspects of registration to submit a federal grant. There are many reporting requirements post-award. Grant writers also really need to know how to write goals and objectives. And these are areas that we just can't delve into today. We even received a specific question to address finances and budgeting. So while we will not be able to devote time to these areas, first I want to say we've noted some of these areas already for future offerings. And what I'd like to say to everyone in our audience, if you have an interest in budget development, a topic that I've listed on this slide that's not on the agenda, and or something else that you think is highly relevant and would be very helpful to you, please utilize the post-webinar survey to tell us that. Finally, we're getting to the end of our housekeeping. Carol mentioned that there are 3 handouts for you, and I've listed the handouts here by title. The handouts were not sent with the registration link, but you can access them right now from your control panel. We invite you to download each handout, and you can either follow along on your screen or you can print them out so that you have them as a reference. Please note, though, the handouts are only available while the webinar is launched. So I just want to make sure you don't miss an opportunity to grab them before the webinar ends today. Now, with that, let's introduce ourselves to each other. Let's see who's in the audience today. So this is a breakdown of all of our participants by professional categories. So overwhelmingly, we are joined by several administrators and persons in management positions. Second to that, you can see that we have almost equal amounts of persons from the healthcare delivery sector, some from education, and other sectors that are kind of all aggregated together. Lastly, we have a small number of participants in our audience who categorize themselves as behavioral and or social sciences. Now, here's the poll that I was most interested in. I wanted to know the experience level of who's in our audience. And as you can see, we've tri-modal experience profile here. So as I said, the sweet spot for this webinar is really going to be for participants who've written at least 2 proposals. However, don't log off. If you haven't written a grant at all, or if you've written a ton, I'm still going to make sure that there are lots of great takeaways for you as well. And I will aim to pitch these recommendations based on experience level. If you need me to go lighter or deeper, again, use the Q&As to ask me those questions, or feel free to email me, after the webinar to have more in-depth discussion. Now, here's what you told us that you wanted to walk away with based on our webinar today. And so I'm going to really utilize my experiences to give you some strategic advice. You'll see that I've included 3 icons here. So I want you to look for these throughout the webinar. If there's something that I feel is going to help you to gain insight into successful grant development, look for that light bulb. And as we'll discuss, success is based on establishing very strong methods and strategies. Next, I definitely want you to walk away with a toolbox of resources. So look for the tool icon. With a pre-assembled toolbox, you'll be much more ready to tackle proposals. Lastly, you need to be able to have some metrics so that you'll be able to gauge alignment between your organization's needs, aims, and capacity, and then what the funding opportunity is actually all about. So I want you to look for this key, and I think this is the symbol that you'll probably see the most throughout the entire presentation. Now, I'd like to say, some people believe that a good funding opportunity is any open opportunity, really any funding that's available. I don't adopt this belief at all. Developing applications is a very time and resource intensive endeavor. And so I believe that the best funding opportunities are those that are well aligned with the applicant organization and the funder. So with that, let's begin part 1 of our presentation, where we're going to talk about the proposal process. All right, Carol, if you could actually engage our first poll while I read the poll question. The poll question is, what single factor do you feel makes developing a grant application seem just so very, very difficult? Would you say that it's the time constraints, meaning the deadlines are just too tight to complete the application? Would you say it's resource constraints? There's too little money that's actually being awarded by the funder. Would it be that there are multiple components of the application that you have to keep straight? Or is it just so very difficult to interpret the guidelines, meaning what is the funder really asking me to do? I'm going to pause for a second and give you an opportunity to make a selection for this poll. Carol, once you feel that enough participants have logged in, feel free to share the poll results with us.
We've got about 80% of the participants who voted. Are we ready to close it? Okay, you should be able to see your results on the screen now, Monae.
That's okay. I can't see them. If you could just give me a quick breakdown so I can appreciate where we are.
So, Monae, we have 38% saying that time constraints is the biggest factor. Then we have 13% saying resource constraints. The majority at 44% says the need to develop multiple components, and 6% interpreting the guidelines.
Absolutely perfect. I love these results. So when I put them all together, looks like we have an almost equal split between the tight deadlines, that being the time constraints, and then developing multiple components. Here's what I want to say about this poll. It wasn't a trick question, okay? I faced each of these barriers in real time, developing multiple applications. And so each of these factors, not only are they real, but they are a continuous challenge. Now, in my experience, one of these factors will generally rise to the level of preeminence, and that's generally the single factor that has to be resolved in order to successfully complete the application. To effectively develop grant applications, it's important to be able to identify what the single factor may be or the multiple factors. But then I want to challenge you to even be able to anticipate what the main barrier may be, because that'll be the key to getting a resolution, especially if you are developing a grant application with a team. So having a mitigation strategy so that you know how to work within a tight time frame can help you not to miss a funding opportunity, and it'll also help you to be able to submit more winning proposals. I'm going to give you some cues later on, actually, as we talk, and hopefully that'll help you with timelines. I just want to give you a quick overview here in terms of funding in the last fiscal year. And so, again, I'm just going to kind of begin my discussion here with federal grants. So thanks to the Digital Accountability and Transparency Act, which is known as DATA, I can actually give you this summary information today. So DATA requires coordination across all federal funders and applicants. And this coordination actually standardizes not only federal financial data, but it also provides transparency so that we understand that $700 billion was available in the last fiscal year. Now, clearly, a lot of that funding was made in the form of formula grants for Medicare and Medicaid, but that still left thousands of funding opportunities that were available. And I'm sure many of you, applied to some or maybe one of those opportunities. If you'd like to read more about this, I have a URL there, usaspending.gov. There's a lot of information, and feel free to check into more. Now, before you celebrate about $700 billion being available, as we all know, there are very stringent procedures in place to determine that the best applicants will be funded, okay? After all, a funder wants to ensure good return on their investment. So today, we're going to focus on strategies, resources, and keys so that you can find that better alignment to become more effective in proposal development. And I want to say, when I'm saying the word effective, I'm also implying a level of efficiency. I really believe in the maxim that you need to work smarter and not harder. And again, I will give you cues that I think will even help you to be more efficient in your proposal development process. Now, hang with me. If you already know this information, I really want to provide this because we do have some participants who do not have as much experience with grant writing. But again, I think that this foundation will be helpful for all of us as we discuss this topic today. So let's just do a quick run through of the major grant types. Some of you actually said I just want to know where to begin so that I can become a successful grant writer. So I really feel that part of that beginning point is understanding the grant types that are available. So number one would be construction and capital. So these are going to fund equipment renovations or asset acquisition. Those are some major funding activities under construction and capital grants. Next would be an evaluation grant. You may see these focusing on performance measurement or maybe quality assurance or continuous quality improvement processes. I've worked on a lot of these grants, and they're definitely a major type of grant. Next, and somewhat overlapping, but definitely distinctive, would be the research grant. Now, primarily when you say research grant, the prototypical grant that comes to mind would be offered by NIH, and people think of that R01 grant for investigators. Now, the NIH funds researchers at varying levels of their career. To be very honest, there's a whole taxonomy of grants. They have their own verbiage, and to suffice it to say, they offer a lot of funding. If you are interested in research grants, I would highly recommend that you hop on to the extramural research office on NIH.gov so that you can really start to deep dive into that process. They have many resources, and you can understand a lot more about their offerings. I want to jump over number 4 and just hit number 5. Training grants are another major grant category. Here you would find resources for workforce development, even clinical training. Let's say, for example, a medical residency program that a healthcare system would want to start and develop. That would be a training grant. In HRSA, actually, the Health Resources and Services Administration, they have an entire bureau that's devoted just to workforce and training. Now, the bread and butter of where I want us to focus today is service delivery. That's number 4. And service delivery grants help applicants to develop programs and projects. What you're going to see a lot of is funding to increase access to services, or maybe to apply evidence-based interventions to a specific population, lots of activities to address disparities or resolve challenges that patients or clients experience related to a specific condition. Now, I want to show you who the major federal grant makers are. This is not an exhaustive list, but this is a main list. And the takeaway here is that there are a lot of funding agencies in our federal government, again, connecting the dots to what I just mentioned as service delivery for our discussion focus today. Then a lot of those service delivery grants are going to come right out of the U.S. Department of Health and Human Services. So if we focus in on the Department of Health and Human Services, now I'm showing you their main operating divisions. And you'll see, 10 or more agencies listed here. Again, talking about service delivery, one of those main agencies or operating divisions here, the Department of Health is going to be the Health Resources and Services Administration, HRSA. They are a main service delivery funding agency. I want to zoom in just one more time and look at HRSA. So these are HRSA's bureaus and some of their offices. And you'll see the first icon here, there's a key. And let me make 3 points here on this slide. So the first point is going back to our participant who said, I just want to know where to begin. Funding opportunities are actually sponsored by specific bureaus and offices. And so a good starting point is to find out what primary opportunities do these bureaus and offices fund. If you can look for alignment with your organization's needs, aims, or capacity, then you can begin to match that to the opportunities of the specific offices. Here's the second point, and this would be aimed at maybe more seasoned participants in our audience. You can also begin to anticipate which bureaus are going to offer funding opportunities. And that's because some federal grants are actually released in cycles. So immediately the Ryan White program comes to mind, and that funding comes through HRSA, through the HIV/AIDS Bureau, which you will see listed here in the left-hand column. Many health system budgets are heavily dependent on Ryan White funding, and I'm thinking specifically of the Ryan White Part C, Early Intervention Services funding. It's a major source of funding that serves many, many people through those health systems. Now, here's the third point. Funding agencies offer several types of opportunities. I purposefully didn't make this a slide because I don't want you to get caught up in this, but I do want to share it in case it helps you to understand a little bit more. So when we talk about funding opportunities, primarily I'm going to be thinking about new opportunities. So this is going to be an organization actually making an initial request for support. This is a project that has not been funded, okay? Another type would be a renewal opportunity. You may know this as a competing continuation. Now, this is where an applicant who has been funded for a particular program, now they have to compete with all other applicants who were funded, okay? So notice that applicant pool has gotten smaller. It's a renewal, so I'm just competing against other people like me who have been funded for this opportunity. The last type, again, this is not an exhaustive list, but these are some of the common types. So this last type of opportunity would be a non-competing continuation. This is a grant writer's favorite, right? Because this is not a competition. It's really that if I do everything that the funders ask me to do, I'm just requesting funding for another budget period. The project has already been approved, okay? So that non-competing continuation, that should really, I don't want to use the word easy, but there's really no competition with that type of funding opportunity. Now let's talk about eligibility. In the proposal process, as you're developing applications, you will have to determine your own eligibility for a funding opportunity. This might seem like a really basic concept, but I want to make the point, eligibility is very important because an application can actually be disqualified, and the funder would consider an applicant non-responsive to funding opportunity guidelines if you're not eligible, okay? Now, funders determine eligibility based on very specific definitions, and these definitions are defined by legislation and other federal agency policies. Now, what does all that mean? What's the take home? What's the point? Even if you're an amazing applicant, if you don't meet the eligibility requirements, you can't receive the grant. And I've seen this kind of come down to two main areas with some of my clients, and that's why I want to share this today. So when you think of the type of organization that an applicant is, let's say, for example, an applicant is a nonprofit organization, and let's say they also provide some educational services to a certain subpopulation. Well, let's look at that a little bit more. Notice in this list that I'm showing you here, both nonprofit and educational organizations are listed, okay? That's a best case scenario because thinking about that applicant type, both types of organizations are here. But remember, a funder is thinking about a specific definition in terms of eligibility. And really what that means, that's legal eligibility, okay? So often an applicant will have to provide proof that there are a certain type of eligible applicant. So for example, this would be an IRS determination letter, which acknowledges nonprofit status. I'm using a very simple example here to make a point, but this can get very complex when you think of, for example, healthcare organizations which are licensed to offer certain services. So Like in New York State, you have an Article 29 versus an Article 31 facility. In any state, a facility could have a change in scope, or you could have an applicant that's actually an entity of a parent organization. And so in that case, then, executive managers would have to determine who is the applicant and what is their legal eligibility status. And again, does that fit the guidelines that have been given by the funder? This is such an important topic that I want to give you some resources here, okay? So this is actually the first tool for your toolbox. I think all of these resources are really good. The first one, in the funding opportunity announcement, there will be a section on who's eligible that's very clearly laid out. Sometimes there are nuances there, and that's a great opportunity to contact your grants officer. Don't worry, we're going to talk about how to do that later on in the presentation, but eligibility is a kind of do not pass go point, so you have to be very clear if you're eligible. Now, I want to make a point. We may have some rural health system clients on the line, and often for HRSA grants, you may have to determine your rurality score. And so HRSA actually has a great resource on their data warehouse site where you can plug in the address. It could be of the applicant organization. It could be a partner site, maybe if you're collaborating with an organization, or, and most importantly, it could be the site of service delivery. So that HRSA data warehouse resource is very helpful to determine the rurality score that HRSA gives to a certain address. Okay, so now let's talk about timeline. So once you know that you're eligible, there are three main phases of the proposal process, and I'd like to view this in a timeline. I'm showing you a pre-award phase, an award phase, and a post-award phase. If you would kind of divide the grant development process up into three parts, these are going to be the three main parts. Now, today, we're really going to talk about pre-award. So zooming in on pre-award, one of our participants asked us today, can you define a list of must-haves for me, Monae? What is it that I definitely have to have for each grant application? And what I want to say, that's a great question. I want to take kind of a step before that. So before I give you the must-haves, let me tell you what you must do. And I'd like to present that to you in the form of a timeline. So first, there's going to be the FOA release, okay? And I'm going to talk to you later about how you can actually know that an FOA is released. So that's going to be kind of the first step in the process, and that's going to begin a countdown. Generally, for federal applications, you have about a 4 to 8 week period to develop the proposal. I will say increasingly what I've found in the past few years, I'm developing federal applications in about 4 weeks. Much less often than not am I getting that kind of 6 to 8 week cushion. Generally, I'm developing applications in about 4 weeks. It's very tight, as many of you noted in that first poll. It's not a lot of time. This registration point in the timeline, this is very important. The registration process alone with the federal grant systems, that alone can take about 6 weeks. And there are so many provisos that are stamped all over the FOA. Registration is a multi-step process, and it often involves authorizing officials in your organization. So this is something you would not want to identify an opportunity and then have to register. Registration is something that you already want to have underway and you already want to have done so that then you can start to look for funding opportunities. Next, of course, would then be creating the proposal. During this time, Often the funder will have some sort of technical support or technical assistance, webinar like we're having today, or some type of conference call. I want to say I wouldn't recommend that you skip these. So sometimes, unfortunately, they are dry, and you will find that the funder is reading the FOA kind of word by word, but hang in there, and I'm going to tell you why. When they offer a Q&A, it's so important to glean and to hear what other applicants, just like yourself, what are they questioning? What are they thinking? Especially if maybe you're new to that agency or that funding opportunity, you're going to hear more seasoned people ask some great questions, things you haven't thought of. They're going to take you deep into the FOA, maybe on page 35, and maybe you read up to page 20. I highly recommend that you look for that technical support, that technical assistance webinar information. It's generally in the FOA, or log on to the funding opportunity website for that program, and there should be information about that, that TA webinar. Now, sometimes, especially with state and local grant proposals, you will see a revision period, and this is painful, but the funding opportunity announcement will actually be revised. Literally, the funder will change some aspects of the guidelines. Sometimes this is in response to a public comment period. Sometimes this is in response to actual questions that have been received from applicants. But you have to be very careful here because, as we've said, you're already in creation mode. So when revisions are made, you got to grab them, and you have to start to scour your application from top to bottom to see what aspects need to be realigned to those revised guidelines. The funder is going to make review criteria based on the most recent guidelines. So if you don't have the most recent guidelines, you will still be judged by the most recent guidelines. The last point I want to make here is that submission can be one whole submission, meaning the full application is due, or it could be a staged submission where there's a first part where certain parts of the application are due. Usually it's a lighter submit, and then there's a second stage where usually there are tons of attachment forms and the all-important narrative and budget are due. Just to give you some tools on the timeline, here's what I would say. Again, I want to respond to the participant who said, where do I begin? And I want to respond to the participant who said, can you give me a list of must-haves for each grant? So to be successful, where do you begin? What do you need to have? You need to have a timeline. I would encourage you, use the timeline that I've given on the previous slide in here, but expand it, and you want to make it specific, to the internal processes in your agency, and maybe even any external processes that you'll need to incorporate into the timeline. So here's what I would say. Here's the list. You want to review the funding opportunity several times. Why do you need to do that? Because the guidelines are going to be sprinkled throughout the funding opportunity announcement, right? So funders don't generally give you everything that you need to know about a certain portion of that application in one spot. It's going to be sprinkled throughout the funding opportunity announcement. So that's why you need to read it multiple times. I highly recommend the second bullet, that you find some sort of project traction there that's going to help you digitally manage that. I work with one that I really love called Productive, and it actually is integrated into email, and so that I can not only comment and talk to members of my team, provide updates, but the software will also prompt us in terms of certain points of the timeline. You want to convene key who are involved in the project and use a project. Okay, so think about a project that's going to be implemented in your community. You want to sit down very early on and determine what does that project concept look like. Here's a must-have. You need to find what's missing, right? So is data required? Do I need some other resources? And make some next steps regarding that. I'm going to give you a great example. I talked about the Ryan White grants before. These grants very often require data queries, right? So often organizations have to go back historically and they have to document how many clients they served. And when I work with large health system clients, that type of data query takes time. The other time allowance that's needed there is then that data has to be interpreted, right? Because sometimes a data pull might need to be revised, or associated data might need to be added so that it helps the grant writer to better explain what happened in a certain calendar year. Certainly, you would have progress reports and other things that you can speak to, but I just want to make the point that it's really important to scour that funding opportunity to know right up front what information are you going to need so that you can get other members of your team going or work with other departments in your organization so that you can have what you need. Then you want to reconvene the key staff, and now you want to refine that project concept. We want to have some agreement on what it is that we're going to do and what it is we're going to implement. Often, I'm seeing more and more in local, state, and federal grants that collaborators are needed. And so the collaboration process, I'm going to talk about this a little bit. What a want to know is not just that you're saying that you're going to have a partner, but that you actually have a letter of commitment or support or some type of document that's actually stating that that partner is signed on and what they're going to actually contribute to the project. This can take time. And remember, a few slides ago, I said that we're dealing with a 4 to 8 week, increasingly a 4-week window. So these are the types of processes that you want to be able to outline and see ahead of time so that you give yourself enough time to actually complete them. Lastly, you're going to want to start to develop all of the proposal components, which I'm going to itemize for you a bit later. I highly recommend that you assemble some reviewers. These are not to be confused with the formal reviewers that the funder has in place, but these can be colleagues at your organization. You may have an informal network that you trust. A grant application is confidential, so it needs to be. But the whole point is, if you've developed the application, then you can't review your own work. Okay, so I highly recommend that you have a team that can help you to actually see not just grammar and spelling, but do the concepts that I've outlined, do they make sense? And do they align with what the funder has asked me to do? Lastly, and if at all possible, early. Federal submissions are managed electronically by and large, and so these systems have to go through validation, they have to check for errors, they have to send you confirmations. All of that takes time. And very often I've seen federal grant deadlines occur very near holidays. And so things happen. Staff take off. And so if you're able to submit, a week before, days before, you will save yourself a lot of anxiety. Now, we did receive a question, and someone asked us, how do I get feedback on my proposal? So here's what I want to say. The last tool that I actually mentioned in the previous slide is that you can think about assembling an informal team to give you feedback. So unfortunately, you can't actually discuss your score with a reviewer, but rest assured, grant applications receive a thorough and comprehensive review that progresses through many stages. The time from submission to award varies, especially when we think about private funders, local, state, and federal agencies. But there are several key dates that are going to be given to you in the funding opportunity announcement. And one of them is an estimated date when awards will be made. Okay, so that's going to really be your benchmark on, when a funding decision will be made. Now remember, the funding opportunity announcement provides review criteria. This is actually the rubric that reviewers use to grade an application. And the reviewer will typically provide comments in each section. So whether or not you're funded, most funding agencies have a process that an applicant can use to request a copy of their scores and the reviewer's comments. So even though you cannot speak directly with a reviewer to get feedback, I highly suggest that you read their comments, because that can most clearly help you to understand where the application was strong and where there are weaknesses, areas that you can improve. Okay. One of the main points
Monae,
that
you're at 45 minutes mark.
Thank
There's
you.
a time check.
Thank you. One of the main points that I want to make today, if you don't walk away with anything else, that is the key to winning a grant is to show past and current success in the area and activities which support the funder's priorities. I want to say that again. How do you win a grant? The key to winning a grant is to show that your organization has previously and currently shown success in the same areas that the funder prioritizes, okay? So how do you do that? Well, I want you to start to think of some general practices. I'm not going to go through all of them, but I'm going to leave them here on the screen for you to think about. And the point that I want to make, these are general operating practices. Some of them are ongoing, and then some of them actually need to occur during an application process. These are not practices that only the grant writer would undertake. These are actually team and actually organizational strategies that need to be considered to actually begin to be successful in undertaking grant development. So often executive management serves as the grant writer for their organization. And so these are things that you want to consider, right? So building partnerships, that's something that needs to be prioritized, because it can't be undertaken at the start of an opportunity unless the opportunity is designed to help organizations develop partnerships. But here what I mean is, if you want to undertake a service delivery grant, then you clearly want to show that you have past experience and you're really good at serving clients with those specific needs, and you have partnerships in place to expand services for those clients, okay? I think this is a very important slide, and I want to actually touch on research in my next slide. And I actually mean something a little different here. So by research, I want to actually help you. Here, you'll see the light bulb and the tool icon. So here, I want to help you gain some insight in terms of strategies, and I also want to give you a tool. So I actually recommend that you do some research into previous applications that were funded, right? So who were they? What did they do? Look for their abstract and actually understand their methods. And what you can begin to do, consider how the program that you're developing compares with what other people have done. This is such a good idea, and that's why I'm sharing it with you. If you would want to do this, let's say specifically you're interested in a HRSA grant offered by the Maternal and Child Health Bureau, I'm giving you a URL here that will actually enable you to do a very advanced search here on many of the criteria that I've listed. Now, I'm giving you this method and strategy. Let me qualify what I'm saying. I by no means am implying that the new program that you design can just be cut and pasted into what, a previously funded applicant organization did. That's not what I'm saying. What I am saying, though, is that sometimes one of the major challenges is I just don't know, what the funder is really looking for. I know what they've said, but I don't know what they're really looking for. This is a great way to look at a previously funded program and understand what did the funder think was funding worthy. And that will help you as you begin those preliminary conversations with your team to actually design a concept. So we're nearing the end of part one. I just want to close here and go over some of the common elements of an application that we're really going to touch more heavily in our next section. So generally, you'll see a letter of intent, a project narrative, there will be a budget, several attachments, and forms. To go a little deeper, the narrative generally will consist of a needs section. That's a very data-heavy section. There will be something called a response or method section. So what's going to be your approach to what you're going to do? Funders are very interested in evaluation. This will take the form of data collection, performance measurement. How are you going to evaluate that what you did actually works well? And then generally there's some sort of capabilities or, organizational capacity or applicant resources section where you actually tell them more about your organization and why you are well suited to handle the funding that you're asking for. I just want to throw this up as we conclude part one. These are some resources that you might want to use as you begin to develop those common elements of the application. The main one that I want to highlight that I think people may skip over, there's actually cited literature in funding opportunity announcements. It's generally in the beginning, but this is where the funder actually tells you how and why the certain need that they've identified is significant. I highly recommend that you don't skip over those pages and actually note those resources. Start your research process there when you actually begin to compile the research that you need for that application. That's generally a very big clue to some beginning and preliminary resources that you can use. I'm going to pause here, and I'd love to take a brief moment and answer any questions that you may have.
Thank you, Monae. So if you have any questions, you can type in or you can raise your hand. I see that there's one question from Mary Cook already. So I'm going to unmute your mic, Mary, and if you want to just ask your question.
For September. September, yeah. That's what I'd do.
Mary?
September.
Mary Cook, can you hear me? Okay, so I am going to skip that. If any of you have any questions, again, you can ask your question by typing, or you can raise your hand and I will give you access to your microphone. All right, does that mean that we don't have any questions for part one? Going once, going twice. All right, Monae, I think you can continue.
Thank you, Nan. Thank you. Okay, well, definitely we will have 2 more Q&A opportunities. I'm checking my social media and I already have heard from one participant. So feel free, like I said, use my email, use my LinkedIn, feel free to message me, okay? I'd love to hear from you. Let's keep going. Okay, part 2. So Monae, give me tips and implementation strategies. I hope that you've already received some tips. I've been very deliberate to do that in part 1, but now I want to actually give you an opportunity where we can apply some tips and implementation strategies, and I'll again be giving you more resources along the way. I would like to start with something a little humorous. One of my colleagues gave me this image. I think it's really funny because often when I tell people that I develop grant proposals, I think, you know, one of these pictures actually comes to their mind, right? Most importantly, and I will share this anecdotally, I engage in conversations with people and they just say, you know, how can you help me get money for my organization? And I say that humorously, but to make the point that people kind of see one of these images in their mind. But to be very honest, grant writing is a skill. And I feel that it's really an exercise in being strategic and efficient. And so again, I want to help you today identify some practices, strategies, and resources to help you to do that. So I want us to go through this scenario, and there's going to be a poll that follows. Don't worry, I'm going to read through this, and then I'm going to give you a summary of the scenario, okay? So you don't have to write anything down, don't worry. But let's go through this. I've adapted this from Cynthia Adams, who's the CEO of Grant Station. I made some tweaks to this, but I think that the structure of the scenario is really good. So let's talk about this. So your organization runs an after-school, recreational, community-based youth program. Although the program is fully funded for the year, you are worried. The evaluation results show that the program outcomes are poor once again. The board has raised questions to the executive director regarding the worth of the program. The executive director has begun to look for new funding opportunities to breathe new life into the program. After all, more funding, staff, and equipment would provide a total makeover. 3 community forums scheduled to solicit input on how to improve the program were canceled due to snow during the winter. A federal grant to promote access to substance abuse treatment among youth has caught the attention of the executive director and now the board. The grant application is due in 4 weeks, and you're the organization's grant writer. Okay, let's move on to the second poll. Carol, if you can begin to open the poll so that participants can participate. Here's the poll question. What is the most significant issue that could jeopardize the grant application success? Don't worry, I'm going to give you a summary of the scenario again. Let me just run through your options. Is it that the current results of the program are mediocre? Is it that there are too many time constraints here with the application due in 4 weeks? Is the most significant issue that there was no opportunity to get community input into the proposal? Or do you feel that it's a misalignment between what the funder prioritizes and what the organization is prioritizing? So here's a summary of the scenario again, and there's the question, and I look forward to hearing your results on this one. Carol, feel free to let me know when you feel that everyone has participated.
Monae, the results for this poll are 25% say the program results are mediocre. No one thinks time constraints. 13% says a lack of community input, and 63% misalignment.
Thank you so much, Carol. Oh, this is a good one. This is a good one. I want to go through some of these choices, and then I want to give you what I feel is the best answer to this one, okay? So let's talk about 25% of you said the program results are really bad. This is important, actually, because I told you in the scenario, this is a national grant, which means that there's a competition, right? You need to be able to show that you're going to well when you respond to the reviewer's criteria. So how is a mediocre program going to stand up? Ideally, you would want to show a strong track record of success. You'd want to be able to pull in that progress report data and build a case for the program. Remember, I gave you a key strategy, right? You get grants based on experience and what you do well. So there's non-adherence to that key strategy. The second thing that I want to mention here, the grant is geared for organizations who are offering substance use disorder treatment, and nowhere is that mentioned in the organization's expertise. Okay, so again, how would the organization be competitive up against other substance use disorder providers? Okay, time constraints. No one felt that that was an issue. I think it's an issue here. With a 4-week deadline, and I'm going to tie in the 13% of you who said lack of community input. Again, there's not a lot that you can do if your organization is not already in motion to be able to successfully respond to this funding opportunity. I want to make a point here to the 13% of you who said lack of community input. This is very valid. So reviewers are trained to look for what I want to call it like an ad hoc data presentation, meaning it's not comprehensive, it's not far-reaching, it doesn't show that community input and engagement is kind of a routine procedure that the organization uses.
Hey, Monae.
And
this is
yes.
Nan. Sorry to interrupt, but I think we're only seeing the whole screen and not your. Oh, okay, so is that what you're talking about?
Is
You
that
meant
better?
Oh, okay, never mind. I think we're okay.
We're okay? Okay. So I just want to say that reviewers look for an ad hoc data presentation. So you want to be sure that community engagement and getting community input is something that the organization prioritizes. But I agree with 63% of you. The biggest problem is that this grant funding opportunity does not align to what the organization does. In addition, we don't even know that it's a need in the community among the youth that are served. And so, again, the key to winning a grant is for an organization to be able to show that they have a winning solution to a problem that the funder has prioritized. And I'm going to give you that key right here. Again, the funder is going to identify a significant problem. What you want to do as the applicant is you want to confirm and identify that significant problem in your application and talk about why it's salient in your community. Then what you want to do is you want to present a winning solution that your organization can implement. That's one of the keys to winning a successful grant. So let's talk about a significant problem. I actually alluded to where I was going to go in that scenario. So let's talk about this. So essentially in our country, nearly 18% of the total adult population experienced mental illness in the past year. Now, when compared to the overall population, persons with a mental disorder are more likely to experience a substance use disorder. And then when compared to the overall population, persons with a substance use disorder are more likely to experience a mental disorder. Nearly 45% of persons seeking treatment for substance use disorder are also diagnosed with a co-occurring mental and substance use disorder. All of this information I actually gleaned from resources on SAMHSA's website. let's go a little bit deeper into this. So we received a question, where do I find grant opportunities? Here we go, grants.gov. In terms of federal opportunities, this is by and large one of the greatest places I feel to search for federal opportunities. And what I'm showing you here, you can actually do a search criteria. So let's say you actually typed in substance abuse as your keywords. Then what I'm showing you as of a few days ago when I did this search, there are about 219 opportunities that are available. If you look at the next box, you'll see all 219 are in the forms of grants. What the opportunity status is showing you is that overwhelmingly, most of them have already been posted, and then 8 are forecasted, okay? So I'm actually zooming in on page 7 of the search results that I actually was able to find. And here's what I want you to see. So I'm just trying to make the point that I actually introduced in part 1 of the webinar. And so that is that you're going to see a specific topic being addressed by multiple agencies. So that third column is the agency. So you see everything from, you know, the U.S. Department of Justice, you see USDA, of course, we see a lot of Department of Health and Human Services agencies such as SAMHSA. We also see the Administration on Community Living, okay? So again, aligning or looking early on at agencies that actually are well aligned to your organization's aims. When you actually get into grants.gov, you know, don't ignore the agency column there. Look for those agencies that you've already pre-identified as you begin to explore specific funding opportunities. So let me fully answer the question about how do I find a grant. Here's what I recommend. I recommend that you subscribe to some sort of grant search. Some people want this to come into their email daily. Some people just want kind of a weekly summary, whatever you prefer. But I actually would recommend kind of a multi-source strategy. So one, actually, if you create a grants.gov account, you can customize the type of email notifications that you receive, and you can actually say, I want a daily listing of all grant opportunities. That's going to give you a national overview of what's available. Then I recommend, based on topics that are relevant to your organization, that you actually employ a topic-specific source. So for example, if you were an educational organization and you were interested in school-based grants, maybe Get Ed Funding. This is a real search engine that I've used. I highly recommend that you subscribe, and you can get emails from Get Ed Funding, again, on the topic of education. Then, I know we're not focusing on private foundation proposals, but I use this as an example. You can actually subscribe to individual grantors to actually get email updates when they release funding opportunities. And here, the acronym stands for the Robert Wood Johnson Foundation. Now let's go back to our topic, okay? So again, based on the data that I provided from SAMHSA, let's talk about substance use disorders and mental health as we actually try to apply that to a real funding opportunity. Just want to give you a quick kind of zoom in, zoom out view. So under the U.S. Department of Health and Human Services, we're going to focus on, before I gave you a preview of HRSA, now we're going to drop all the way to the bottom, and let's actually talk about SAMHSA, the Substance Abuse and Mental Health Services Administration. Okay, so this is an actual handout that you have available in your control panel. Feel free to download that. I'm going to begin our discussion, but this is actually a real funding opportunity. And I actually worked on an application for a client recently. As you can see, the application deadline for this funding opportunity was March the 5th. So this is almost as close to real time as we can get. Now, as you can see, this is coming from the Department of Health and Human Services, and as I told you, this is coming from SAMHSA. Now, I want to kind of just allow you to take in the front page, and here's what I want you to get. There are key themes that the funder is cueing you right from the first page, and here's what they are. So, substance abuse, mental health, minority populations, HIV/AIDS. Those are the key themes that I understand that are going to be highly relevant to this funding opportunity, and let me say, service integration for these populations, okay? So right away, as I'm selecting this funding opportunity and as I'm looking at how to be successful, I know that I'm going to need to address these key themes, but most importantly, how to integrate services for persons as it relates to these key themes. Please don't get nervous. We are not going to go through all 87 of these pages. It's just not a good use of your time. But here's what I'm trying to show you by looking at this table of contents. So if I were to actually draw a line through the screen here, the first 14 pages, this is actually the background, okay? I highly recommend that you don't ignore any of the pages, but I just want to kind of structure how this funding opportunity is laid out. So the first 14 pages are background. Then if I look at a second chunk, which would be pages 15 to 21, that's going to be information helping me to develop my proposal, okay? So most of my questions about what I need to include and how are going to be in pages 15 to 21. Then pages 22, mostly page 22, that's going to give me a lot of my post-award information. And again, that really wasn't a topic covered today, but some of those reporting requirements and other guidelines are going to be there. Now, the appendices, there are appendices A all the way through L. In this particular funding opportunity, I would say more so than others that I've seen most recently, each of these appendices was worth its weight in gold. SAMHSA actually provided templates in these appendices. And so these were not to be missed. And I would say, please don't ignore appendices. I'm not saying you'll always get templates, but don't ignore them. The information included is as important as everything that's not in the appendix. Now, here's what I recommend. Here are 3 tips right here. I recommend that you keep the funding opportunity announcement as an electronic copy. Some people like to print. Here's why I recommend that you keep it as an electronic copy, because as you're developing, you can easily do a Control F and you can find keywords and phrases just by typing them in the FOA. It's an efficiency strategy and it'll save you time. I also recommend that you use your PDF features in Adobe and actually highlight and bookmark, key pages in the funding opportunity announcement that you want to refer to. And again, as I've said, read and reread the FOA because the guidelines are going to be sprinkled throughout, okay? So let's quickly go through some of the key points in this funding opportunity that I've highlighted. Again, we're not going to go through all 87 pages, but I want you to see the purpose, which is in the red box, and that is to integrate evidence-based, culturally competent mental and substance use disorder treatment with HIV primary care and prevention services. And right there, SAMHSA is giving you the population of focus. They're also telling you what they expect the end result of the program funding to accomplish, okay? That is a very important portion of this funding opportunity announcement. I want to call your attention to the chart towards the bottom of the page. You can see that 10 awards are estimated, so this is highly competitive. It's a national competition, and SAMHSA is only going to award 10 applicants. Next, you'll see that the budgets should include a total of $485,000 per year. If you drop down, you'll see that the project period is for 4 years. So that's 485 times 4. And the anticipated project start date is at the end of September of 2018. Let's keep going. I want you to see 2 of the major expectations here. So this is very important. The first one, SAMHSA expects that applicant organizations will be ready to start service delivery as soon as possible. And this is defined as month 4. This is very important because there's an actual narrative question in section B, number 3, that asks applicants to give a timeline for the project period. So here in the timeline, what they're telling you is that month 4 of year 1 should very clearly show project implementation starting. In the second box, I'm showing you the key personnel. This is not always done, but here SAMHSA has actually given you the percent effort that they would want to see 3 key personnel utilizing in your budget. This is not negotiable. And so again, when you talk about being responsive or non-responsive to a funding opportunity announcement, these expectations are requirements. Now, what are they actually funding you to do? This is a key page of the funding opportunity announcement. So 5 key required activities are given. So applicants need to provide HIV hepatitis prevention services. They need to provide evidence-based mental and substance use disorder treatment, peer support services. You need to implement outreach strategies and case management. So there's a section of the narrative where you would actually explain, you would blow each of these out to talk about how your organization would achieve this. I want to give you a key here. When you look at the required activities, you also want to be thinking, what staffing plan do I need? Now, on the previous slide, SAMHSA gave us key personnel, but what staffing plan do I need to implement to be able to carry out these key activities? It's a very important way to think as you're actually going through the application. Here's another great thing that SAMHSA did here. So we're actually seeing 2 boxed areas that pertain to the budget. But if you were actually to look at this page side by side with the table of contents, this information is not provided in the section that's devoted to the budget, okay? So again, you want to read the funding opportunity announcement several times because the guidelines are sprinkled throughout. So here's the requirement. You need to include a grantee meeting, travel to the grantee meeting in your budget. And they want to see this in years 1 and 3 of the grant only. So you would be non-responsive if you didn't actually show the funder and talk about this in your narrative that you fully expect your staff in years 1 and 3 to attend that meeting, and you've shown the line item for travel in your budget. Okay, here again, they're telling you explicitly that your total annual budget spend cannot be more than $485,000. Now I'm on page 15 of the funding opportunity announcement, and this again is one of the most important boxes here. So SAMHSA is telling you specifically how to number and how to provide headers and structure your narrative. There's a very key point here. So not only does the narrative only need to be 10 pages, no more than 10 pages, okay? But they're actually telling you how to count 10 pages, and that's very important. It can be confusing. You might think that's something very simple, but it can be confusing to know how the funder would be counting the pages. And they're explaining that to you right here. Now I'm on page 36. This information would be in the funding opportunity announcement. There's also going to be a lot more specificity in something called the SF424. It's a downloadable PDF, and I highly recommend that anyone undertaking a federal grant would have the SF424 document handy. What this box is showing here on page 36, but also in the SF424, you're going to get very detailed guidelines in terms of font, color, size, margins. All of these are necessary requirements, and this is what the funder uses to gauge if you are fully responsive to their funding opportunity announcement. Lastly, and certainly not least here, we have our project officer information. And I alluded to talking to project officers a little bit earlier on. Here's what I want to say. Project officers can be very helpful. In my experience, I email project officers when I'm not clear or when I need follow-up on something. Some project officers do not respond. Many do. So you can imagine the incredible responsibility that they have to be responsive to all applicants. But I just want to say, if you do have questions during the development of your proposal that were not answered well in that technical assistance webinar, that were not answered well in the Q&A document that came out of the technical assistance webinar, that you cannot find in the SF424, definitely contact your project officer. Okay, so let's kind of put this off. Now that we've gone through the funding opportunity announcement, I want you to think like a reviewer, okay? So what I've done here is kind of schematically given you some of the 4 main parts of the application narrative. Here's the first rule. Only information included in the appropriate numbered question will be considered. So if you're responding to question 1, then information pertaining to that needs to be in question 1. A reviewer will not consider information in question 3 in response to question 1. That seems like a very basic point, but I want to say this because as you're working through an application, you'll often notice that the same question seems to be being asked in multiple places. So you want to respond to that question and repeat yourself as many times as you need to so that you receive full credit where the question is asked. Now, even though the sections are scored separately, they're not independent. So that means you want to ensure a consistent thread. There should be a consistent alignment between all of your responses in the narrative and throughout all of your application components. A few moments ago, when I showed you that travel requirement, and I mentioned that not only do you need to have that as a line item expense in your budget, but you want to talk about that maybe one time, mention it in your narrative that, maybe to support the evaluation or the dissemination or the training components, you're sending staff to that required grantee meetings. That's the way to weave your application components together. Thirdly, this is not to be underestimated. Help your reviewer to navigate your proposal. So I've worked on federal proposals that are 80 pages and more, okay? Now here the project narrative is only 10 pages for this opportunity, but be kind to your reviewer, right? Give them the headers that they've told you to use. Make sure that everything is clear and they're not hunting for the response. Again, this is how you begin to craft an application and actually think like a reviewer. Now let's go just a little bit deeper. Again, a participant asked us about some must-haves, and I kind of position that as must-dos when you undertake an application. And here's a strategy that I highly recommend. I really recommend that you map out the narrative sections. And so what do I mean by that? Well, I'm actually seeing not only how many sections, I'm seeing the sections by title, I'm seeing the relative weight that the reviewer has given to each section, and then I know how many suggested pages I'm given, again, the reviewer gave me this information. This is the number of pages that I should approximate for each section. Now, the page total 10, that's non-negotiable, and we went through that. But here's what's important. When I do this schematic exercise, what I can see, sections B and C are where SAMHSA is putting the most emphasis, not only in terms of pages, but also in terms of points. And so for me to score well in this application, I need to have a very strong response developed in sections B and C. Now, even though I'm showing you this strategy for the narrative sections, I actually recommend it as a larger strategy that you use for the entire application. And here's why. I told you that federal applications, you know, they can be 80 pages or more. There will be a total page limit that the funder explicitly states. If you don't estimate page tally as you're developing the application, you could set yourself up to run into problems. The funder is going to print the application, that's what they state in their guidelines, and once they reach the page maximum for all of your components, they stop. So you want to make sure that you never reach that maximum requirement so that your entire application can be reviewed. I can just tell you how this can get amplified. Let's say you're working on a team and someone on the team is assembling the bio sketches or, you know, resumes and CVs for the key personnel. And let's say you've allocated 2 pages per bio sketch because you're going to truncate them and that's allowed in that funding opportunity announcement. And all of a sudden you have 5-page bio sketches for 3 required personnel. You're already at 15 pages. So again, I highly recommend using this mapping strategy, not just to see the funder's emphasis and weights on certain sections, but also to help you to plan your pages accordingly. Now, I just want to quickly kind of do this more hands-on aspect of the webinar, and I want to actually go through how to think like a reviewer as you're preparing these project narrative questions. So I just want to read A2 and then B1, and then we'll talk about this briefly. So section A, population of focus and statement of need, question A2. Describe the extent of the problem in the extent of the need for the individual.
Monae, can you repeat it? You were broken up a little bit in the slide.
Sure. So A2 is listed there on the slide. You're going to describe the extent of the problem in the catchment area. You're going to include service gaps. Then you're going to document the extent of the need for the individuals in the population of focus. Most importantly, identify the source of your data. Section B, which is the proposed implementation approach, the first question is asking you to describe the goals and objectives of your project plan. Align them to your statement of need. That was the preceding question that I just read. Then they're asking you to actually estimate how many persons that you would serve during the project period. Okay, here's my strategy. I recommend that you start by reviewing the problem, which the funder gave on pages 5 and 6. Utilize the data that they've given you there in terms of prevalence. Sometimes they'll give you incidence data, and then actually go to their website and start doing a data search to inform question A2. Now, in terms of service gaps, if you are an experienced provider in your community, generally you have a sense of what the service gaps are for your clients, and you also know kind of who the other provider agencies are. But I want to give you a really good tip. So SAMHSA, as well as other agencies, they actually have a treatment or service provider locator on their website. So on SAMHSA's website, it's actually findtreatment.samhsa.gov. And there you can do a filtered query. So you can actually search for what providers are in the service area, let's say by your applicant organization zip code or by the implementation site zip code. This is really important. Again, in A2, the requirement is to identify the source of the data. So it would be great to not only identify the service area gaps, but to tell SAMHSA that you used their treatment locator to actually validate the service gaps that you've mentioned, okay? Now let's move on to B1. Again, you can clearly see that these two questions are linked. Now, I don't have time to actually design strategies and actually do more didactic discussion about how to craft goals and objectives. But here's where I want you to start. So the funder's purpose is given on page 5. That was one of the first pages that I showed you with the big red box around it. It started, the purpose of the program is to. So here's a clue. Your goals and objectives need to align with every aspect of the funder's given purpose, okay? Now, you also want to weave in other aspects that are in this 87-page funding opportunity announcement. So you want goals and objectives that relate to your staffing plan and your capacity. Definitely you want to be talking about those 5 required activities. In this funding opportunity announcement, SAMHSA actually gave the required data elements that applicants would need to collect and report on. B1 asks you to approximate service delivery targets. So that is, how many unduplicated participants are you going to serve in the life and annually of this program? And then you want to be thinking about outcomes in terms of what will participants gain? What will they learn? What type of health status or behavior change status indicators would be important here? All of that goes into a very robust formulation of goals and objectives. Now, thinking like a funder, thinking like a reviewer, remember, this is a highly competitive program. So 10 programs will be funded, okay? So what you would want to think is, in terms of approximating a service delivery target, again, that's not something that you could probably develop in a silo. You may need to involve, the project director, the principal investigator. You might need to involve, high-level management. You may even need some projections from other departments in your organization. But that number needs to be competitive for the funder to consider investing in your program, given that only 10 applicants in the country will be funded. Now, I just want to touch on this, and we're nearing the end of section 2, so I just want to touch on this. This is kind of understood that if you are actually going to seek funding from a certain agency, that you understand how that agency defines certain terms, okay? Reviewers are very well trained. And so if an applicant is not very conversant or doesn't understand what the funder means by certain wording, then a reviewer can pick that out. So I've given you just a sample here. This is not all inclusive, but these words, integrated, collaborative, coordinated, co-located, some of these words actually appear in this funding opportunity announcement. So when you craft your response and your methods, you really want to make sure that your response is using and demonstrating that you understand what this means. So if you were to say that the services in your program are going to be geographically co-located, right? That means in the same clinical space. They're going to be geographically co-located with the behavioral health services. Or even better, if you're going to say the services are going to be integrated, same space, same collaborative multidisciplinary care team. And you say this care team includes social workers and physicians and care coordinators. And this team performs case conferences and morning huddles. Well, you're showing the funder that you are very clear not only what these terms mean, but that you've designed them into your program concept. Now let's just look at one more project narrative question. So this is actually section D, staff and organizational experience. And there are two questions here, D1 and D2. So D1 is asking you to describe the experience of your organization with similar projects and or providing services to the population of focus. They also tell you that you can identify a partner that can actually work with you in this project as long as you state the partner's experience level as well. This question emphasizes one of the keys that I gave you from the start, right? The key to winning a grant is to show past and current success in the areas and activities which support the funder's priorities. And here's the question. I don't know if you remember from high school chemistry, but there was a term called rate limiting step. So what's a rate limiting step? A rate limiting step in chemistry is it's a step in a pathway, right? So maybe a metabolic pathway or a reaction pathway. It's that single step that determines the rate of all other steps in the pathway, okay? I want to kind of say in this instance, D1 is the rate limiting step in the whole narrative. If you could not demonstrate your service delivery experience, then that inability to show that can jeopardize the entire application, okay? Remember, we looked at this a few moments ago. This entire section is worth 20 points. So to SAMHSA, this response is very important. Now, they've given you kind of a way forward. So let's say that you don't have full experience in this area, but by engaging a partner, your experience plus the partners fills in any gaps in the other organization. That's a very strong way forward here, and they've given that to you as an option. You can read that into the question. Let me show you the second rate limiting step in the equation though. If you take that way forward, partnerships take time to cultivate. And remember, I talked about that a bit when we went through some key practices and processes, okay? So just something to think about as you're looking at funding opportunities and you're trying to find that alignment between your organization and what the funder is asking you to do. Those practices, those that are ongoing, they're very important to get a firm grasp on and prioritize because they're relevant as you begin to explore and actually describe what you're going to do in a funding application. Very quickly, I want to draw your attention to D2, which is asking you for a complete list of the staff for your project. Remember, SAMHSA has already given you 3 key personnel and their level of effort, okay? So here's a strategy. I recommend that you start the application actually with the budget. I think that's a great place to actually start any application and actually start with the personnel section. Here's the reason why I like to do that. If you start developing your budget first and you start that personnel section, well then you're going to align your staffing plan to the required activities in the funding opportunity announcement, and it'll help you to very carefully consider what your funding needs are. So as you begin to describe the roles, you're really going to help the reviewers to judge your competence. And to some degree, the reviewer is going to be looking for how well your funding request matches the scope of your project. A way to enable yourself to do that very well is to start by thinking through your staffing plan first. Now, I want to make a point here that I haven't really mentioned up to this point, and that is dealing with sustainability of your project. Sustainability is a very complex and intricate discussion, and I'm just going to kind of touch on this from a very high level. And I don't mean in a brief touch on this to say that there's a one-size-fits-all approach to sustainability. I don't mean that at all. But I just want to highlight kind of how the funder thinks about sustainability. So one way that you can show the sustainability of your program is actually through a partnership, right? So actually through collaboration, you can show that you have a plan to sustain the program into the future. Another way that you can show this is by continuously training your staff, right? By investing in your staff to actually enable them to do the program well now and in the future, you're actually giving a nod to your approach to sustainability. This is another good mention in section B, number 3 of your timeline. And again, that's how you weave the thread of sustainability through various aspects of your application. There's a good resource that I would actually give you on sustainability, and that's on the Annie E. Casey Foundation website. If you just go on their website, or you could Google Annie E. Casey Foundation and look up, it's called End Games, kind of like Hunger Games, but End Games, the Challenge of Sustainability. It's about a 30-page PDF, and I highly recommend that that's something that you take into account if you're interested in more information on sustainability. I'm going to pause there to see if we have any questions in section 2.
All right, thank you, Monae. So if you have any questions, you can use the raise your hand feature, and I will call on you. We do have one question that was typed in, and it's from Nalita. And the question is, do I need to register to have access to the compendium evidence-based practices?
Very good question. You do not. You do not. You're talking about that CDC compendium, I believe, that I put up in the beginning. So no, I will kind of let you know that once you start clicking through those resources, you will kind of find one after the other. So just kind of get ready, prepare a folder that you're just going to start downloading many evidence-based practice documents in. But thank you for asking a question about that. I highly recommend that you download that resource.
The leader said thank you.
You're welcome. You're welcome. Nan, I'm also going to advance to section 3, which is our overall Q&A, and I'll take any questions at this time on the entire presentation.
All right, again, if you have any questions, you can raise your hand, or you can also type in. I'm seeing some comments from Nalita that she thought it was a different document, and she has already done what you suggested.
Fantastic. And what I will also say, feel free to email me if you want more information. Some of the evidence-based practice documents that I've also come across, I've actually cataloged them in my personal file. So if that's an area of interest to you, feel free to shoot me an email.
Okay, so we're not, I'm not seeing any questions, or I'm not seeing any hands raised. So that means we don't have any questions at this moment. But again, Monae has her contact information listed here. So please feel free to contact her. And we also have a few handouts in the handouts section of your webinar. So if you want to download any of them, please do so. And we will have the recording of this webinar available, and it will be sent to you via a post thank you email after the webinar concludes. And we also have a post webinar survey that we would like you to fill out. I think it's gonna automatically come to you as a follow-up. So please do fill out that survey with your thoughts. And if there's any request, we are hoping to do these webinars, whether they're on grant writing, on something else in the future. So we would really love to hear your feedback on how today's webinar went and any other topics that you're interested in for the future. Monae,
Thank you, Nan.
thank you so much for this. And if you have any words of wisdom, parting.
I just want to say, thank you again to UNE and the GPPH team. You all have been so great to work with, and I'm just so excited that we were able to offer this to our community. As Nan has said, feel free to contact me. Your feedback will be most important. In terms of words of wisdom, I'm going to say fight on. Continue to develop grants. Applicant organizations that are funded well serve their organizations in areas and places that are most needed. So do not be daunted by the process. Definitely amass the resources and strategies that you need and fight on. Fight on.
That is very good. Thank you. And thank you everyone for attending today's webinar. We really appreciate it, and we will appreciate your input on the survey that is about to get sent out. Thank you.